How is the saliva test comparable to the Dutch test? And both of these are better than blood serum. So just in case you ask, blood serum doesn't get it done. So let's get into it. So let's start. The Dutch test, did you know that it actually stands for something? It is dried urine test for comprehensive hormones. So this Dutch test is a test that looks at dried urine, and it's collected over various times over a 24-hour period. The Dutch test is a little pricey. It is not covered by insurance. It is about $400 usually, although you can add extra things on to make it up to $1,000 versus a saliva test, which is $100, but you can also add things on. So there is a price difference for sure. So the Dutch test is better at looking at cortisol. So for me personally, cortisol is really important to measure, but the Dutch test, so more expensive, but yet if your cortisol is an issue, it is really important. And the other thing is, it's a little bit different about the Dutch test. It's a really comprehensive test. And so it's looking at your detoxification pathways. It's looking at metabolites. So it's a nice one to start with because it gives you a ton of information, but you don't need to do that level of extensiveness all the time. So the saliva test is oftentimes what is done a couple times a year, every 3 months, every 6 months, and it is easier on your pocketbook because it's $100. So just so you know, saliva tests are sensitive and accurate. They are reliable at measuring the available hormones that you have. And the saliva test looks at it over a period of 24 hours. Blood tests are a snapshot. It's a grab at one moment in time. Now, if you get blood work done, that is wonderful. We need you to get blood work done, but we need to have a real conversation that if you are a woman and your hormones are off and the only test you're getting done is blood work, you aren't getting the full picture. So reasons why saliva testing does need to be done, my bottom little bullet point, hormone testing may be done on a regular basis, and you know what? You need to know your levels of hormones because if you are doing hormone replacement therapy, we need you at your physiological levels. We're trying to make you balanced. We don't want to underdose you. You don't want to be overdosed. You want to have a physiological, normal homeostasis, and that's why you check your levels. So hit the plus sign and follow for more women's health and wellness tips.